I think in terms of one of the commonest cosmetic surgery procedures performed by plastic surgeons, a blepharoplasty or eyelid operations is one, and particularly upper eyelid surgery. And it's a great operation for patients who feel they've got excess upper or lower eyelid skin, particularly upper eyelid skin, and where it makes them feel tired or look tired even when they don't feel tired. And the trick I find with the patients is to decide whether it's purely upper eyelid skin excess that they have, or whether it's a combination of that and the fact also that their eyebrow has drooped a bit. And it may be that their brow actually needs to be repositioned or re-elevated, which is a different procedure, and that needs to be pointed out to the patient. But if they're just going to have a blepharoplasty, upper eyelid blepharoplasty operation, that's something that can be performed under local anaesthetic. It can be done as a day case operation. I warn patients that they should assume that they're going to get black eyes, but often they don't. And the change in appearance very quickly is excellent, and people look fresher, and they don't necessarily look as if they've been operated on, and they get comments from friends and family which are all good. So I think it's an operation which is a lot of facial appearance change for the downtime and for the cost of the surgery. So upper eyelid surgery is excellent from that perspective. What I do is I get the patient to look straight ahead of me, and as I say, I would assess their eyebrow and their brow position. If it's just the eyelid skin excess I'm going to go to, then I get the patient, when they're lying down, I get them to close their eyes gently, and I get a pair of forceps, and I just pinch the skin excess, and I draw a line across the top of what we call the tarsal plate, which is the firm part of the eyelid, and then I draw a line there, and then I pinch the excess, and then draw a top line on the top part of the excess, and effectively take that out. And then in some patients they also have some bulging of the fat on their upper eyelid, particularly on the inside you'll see with people, and that can be tweezed out and reduced, not hugely, but a small amount can be reduced, and then I stitch it all up. Some people will use skin glue to close. I just use a stitch which comes in at the outside and then above the nose, and just as a wiggly stitch all the way in and out, and that stays in place for a week, and then at a week we just pull it out and the eyelids heal beautifully. It's a really good place to have a scar which is very easy to hide. The lower eyelids I find are more fiddly. I think it's more difficult for patients to have that done awake, because I tend to use a silicone eye shield placed on top of their eyeball just to protect the surface of their eye. And whereas with upper eyelid surgery your eyelid's closed, with lower eyelid surgery I'm going to be moving things around. The scar is just placed, in my hands anyway, underneath the eyelashes, and then coming out into the crow's foot area. And then sometimes I'll also make a scar on the inside surface of the eyelid as well to reduce some of the fat there. But it's the same kind of procedure in terms of taking away some of the skin excess and redraping the underlying tissue and resuspending that. But it takes a little bit longer and is a little bit more complicated, and there's sometimes a bit more downtime and bruising from it. In terms of expectations, I tell patients that they should expect to have bruising, they should expect to have swelling and potential black eyes. I say to them that they may well have some dryness, or conversely some wateriness in their eyes, and they'll have some skin tapes on. I talk about, again, risks and complications that they may get, and the most serious complication of eyelid surgery is the potential for blindness, which sounds drastic, but it is a potential risk, and that's why I try and find out as much information about the patient as possible, so that if they have high blood pressure and they're on blood thinning drugs, then I generally would try and persuade them that this was not a sensible procedure for them to undertake, because it's putting them at risk of that kind of bleeding problem. Asymmetry of healing is common, so whenever you operate on sort of two sides, then one side sometimes will heal a bit more quickly than the other. and in that case the patient can think that the side which isn't healing as quickly is something's going wrong, and it's just that it's not settling as quickly rather than going wrong. Asymmetry of the result is possible, but often the patients have asymmetry to start off with. And then with lower eyelid surgery particularly, patients can have weakness of their lower eyelid, and they can end up with the lower eyelid being pulled down or drooping down, and that becomes a nuisance because it looks a mess, and also because their tears don't come and drain normally into their nose. They come down their cheek, and that's a real nuisance for sometimes 2 or 3 months post-surgery.